So I'm just going to do a brief introduction here tonight. I want to introduce Dr. Melody Rodarte to all of you. She's been practicing since 2006, and she's board certified in internal medicine and obesity medicine, and also certified in hyperbaric medicine, wound care, and medical aesthetics. She was named one of Phoenix's top doctors in 2017. She's been married for 20 years and has twins turning 16 this month. Woohoo! And she loves helping people stay healthy and out of the doctor's office. So welcome, Dr. Rodarte, and thank you so much for your time and for getting on with us tonight and being willing to share with us and teach us some valuable information to become healthier, happier, and lead less stressed lives by biohacking.
Thank you so much for inviting me to do this Zoom with you. Whenever someone invites me to talk, I love it because, as you know, those of us in the health profession, when we find something we love, we can't stop talking about it. And we want to just keep educating and educating and educating so that we can empower people. So thank you for having me.
Yes. Would you please share with us a bit about your history or your background with us as a doctor of internal medicine and obesity medicine?
Yeah, so, I'm a DO, I'm a doctor of osteopathic medicine, and it was important for me to go that path from a young age because I got to see what natural things could do also in our household. We didn't always go to antibiotics first, so I liked knowing that there was more than just pharmaceuticals that were available. And so as I started in my practice, I learned a lot of that, especially with doing wound care and hyperbaric medicine. A lot of 15 years ago, we were doing high dose vitamin C's and vitamin E's and drips, and realizing that too much of a good thing, too much of antioxidants can actually become pro-oxidants. So I learned very young that there was definitely a balance. And so I always looked to team up with other like-minded practitioners. And so I feel very blessed 4 years ago when my colleague's wife wanted to tell me about this because I was searching for something that could help reduce the stress for my son. He has an autoimmune condition called alopecia, and all of my traditional things that I was doing was not fixing the problem per se. I wasn't being able to really help him in the manner that I wanted to. So learning about what we have our hands on has been a game changer for us, and I can say we are biohacking his autoimmune process.
Awesome. So can you explain what biohacking is?
Yeah, it's taking a complex system and breaking it down into less, and taking control of it. In our language, we're using that term biohacking with using nutrigenomics or using nutrition to enhance gene expression. So our bodies can be really complex, but when we break it down into systems and know how they communicate with each other, and especially when we use nutrition and other modalities of treatment, we can take control. We don't have to be grow old the way that our parents grew old or our grandparents grew old. We actually have a chance to change that gene expression.
Awesome. So can you explain to us, I'm sure that there's lots of people on this call that are currently taking supplements. So, but what is the difference between supplementation and activation?
Yeah, that's a great question. I think I talk about it multiple times during the day. The best example I can give is with supplementation. You are supplementing, you're giving your body a tool. Let's say when you eat your green leafy vegetables, when you eat blueberries and strawberries. And so what you're doing at that time is you're neutralizing a free radical at a 1-to-1 ratio, and it's one and done. That nutrient needs to be digested, it needs to be absorbed, or that antioxidant that you're taking. when you activate your body, there's a couple different pathways that we have, and we can go more into depth with that later. When we activate it, you're releasing your body's own antioxidants, which can be released at a rate of 1,000,000 to 1 instead of 1 and 1. And so you're just being able to reduce free radical damage and oxidative stress at a exponential rate versus a 1-to-1. I think some people even, I can't remember who the first person was to give this example, but going into a fire with a cup of water versus like a fire hydrant with the long hose and blasting it. So supplementation is the Dixie cup, and activation is the fire hydrant with the big hose to put out the fire.
Awesome. So you mentioned oxidative stress, and is that something, why do we have oxidative stress, and does it affect everyone?
Unfortunately, the answer is yes. We start aging, just because of the food we eat, what we're exposed to, whether or not we live in, I live in Arizona and there's pollution and it's hot and everything. Or if you, I think you're, I've got someone watching in Alaska, cleaner air, nice and pretty weather, UV radiation, UVB radiation, all of those types of things, they start to age us. And free radical damage causes oxidative stress. And if we don't clean it up, our natural mechanisms work great. And between 18 and 25, they can start to slow down. And that's when we start to see certain disease processes start blooming. Unfortunately, oxidative stress can affect any cell in our body, and depending on which organ system is affected, it can look like a specific type of disease that forms. It can actually affect our gene expression. So we want to reduce oxidative stress and free radical damage.
So what are some of the research signs of oxidative stress, and how could you access that research?
The best place for me is going to PubMed. And so, if you're worried about, what if oxidative stress is linked to a certain disease, you can go there and type in oxidative stress and disease XY, like hypertension or, heart attack or Alzheimer's or ADD. You can type in any of those that you'd like to learn more about, and you'll be overwhelmed with the amount of research that's there regarding oxidative stress and disease states. We know for sure over 200 diseases are linked to oxidative stress.
And is it possible to see oxidative stress or signs that are linked to oxidative stress in children or animals, or do you have to be a certain age for you to notice something?
Unfortunately, it can affect any of us at any age. So my son is a perfect example, at 5 getting alopecia. Unfortunately, there are cancers that are in children like ALL, and we are seeing higher autism and ADD and ADHD, and I know it's linked to the environment and the food. And so there's no, I can't even think of the word I want to use. It can hit any age, any race, any color, any of us. We are all exposed to, and it can be detrimental to any of us.
Why do you think that we are not educated about oxidative stress, or even some medical professionals are not aware of what oxidative stress is? Why do you think that is?
Because there isn't an overall pill to prescribe. Unfortunately, I think it's because until now we really didn't have the tools to reduce oxidative stress. So why teach about it when we really didn't have an answer to reduce it? And I'll bring the term, the term NRF2 up. It was really discovered in 1999, this protein pathway. but things didn't really come to fruition until the 2000s, between 2002 and 2005, where we understood that we really needed to activate this NRF2 pathway, which is the master regulator of a cell, and its job is to allow our body to release our own antioxidants. And when that happens, then oxidative stress is reduced. So prior to all of this, and we just didn't have a good answer on how to reduce that oxidative stress. And in my specific world, in the allopathic osteopathic, a majority don't really learn about, the natural ways of reducing stress. We're always kind of going to pharmaceuticals first as a Band-Aid, unfortunately. I'm not saying all pharmaceuticals are horrible. Thank God we have them, specifically like antibiotics. I mean, I wouldn't want to die of sepsis or certain pneumonias, but I think there's got to be a balance. And now if you start looking at the literature with NRF2 activation, it's going to be exciting because it's going to rewrite medical textbooks and the way that we treat ourselves, we treat our patients, and the way that we fight the aging process.
So this NRF2 activator that we have our hands on, this Protandim NRF2 Synergizer that LifeVantage has created, what does it do that other products have not proven to do?
Well, with our human study, we showed that we reduced oxidative stress by 40% in 30 days and up to 70% with continued use. So that was really incredible for us to see that in a human study, and it didn't matter if it was a 20-year-old or an 80-year-old that was tested. And so the FDA actually allows us to make that statement because of the human study, which can be found on PubMed. And so that's right now what's setting us apart is the multiple patents and the degree of synergy that is found. It's really difficult to patent something unless it's shown to do something different. So I can't go out and patent turmeric. It's just widely out there, right? But if I find a blend that does something, a proprietary blend that does something that we can prove, then we can patent it. And that's why Protandim has 7 patents on it, because of it showing reduction in inflammation and reduction in scarring and reduction in, like, that fibrosis is another word for scarring, and increasing of gene expression. I mean, it's really incredible if you read through the patents itself. And I'll throw in there, our NIA study is incredible. It's a 10-year study done in separate different universities, funded by the government, not by Protandim. And Protandim was the only natural supplement shown to extend lifespan. And we're talking lifespan here, not disease span, better life, healthier life. That's what lifespan is. And so it's incredible to see the science that has been done with this product. That's what attracted me, is knowing I could go on PubMed and read articles from different universities that used it in their studies.
So you have the studies, you have the patents, the research is there, but what if you use the product but you don't feel any changes in your body? How do you know that it's still working?
Well, most of us don't feel like we're aging until we've aged. So the fact that we have that human study showing that across the board there was a reduction in oxidative stress, we just know that we have a tool to slow down that aging process and to help our cells properly function. So some people, might not feel anything. And the neat part will be, like, as they start to grow older, they'll be like, they might not have the ailments that other people their age are noticing. Or I've liked a lot of people who, now we're going into the winter season and they're the person in the office that, is not as fatigued or doesn't get an upper respiratory infection, and they come back and like, why didn't I get sick where everybody else did? And I just say, you have a mechanism happening inside your body that's taking out the trash. And so trash isn't being built up inside your cell. Your cell is being able to function normally. And so it's not to say that nothing bad will ever happen. It's just being able to live your best life.
So Protandim Nerf 2 is the flagship product. And then a product came along for something called mitochondrial dysfunction. Can you explain what that is?
Yeah, so unfortunately, we're realizing how it, well, I should say fortunately, we are realizing how important our mitochondria are. We used to just think it was linked to energy but it's linked to so much more, more than just neurologic disorders. It's been linked to cancers and diabetes and just so many disorders. I will stop and say I was floored. So like 2 years ago, I had to recertify for my internal medicine boards, and I was listening to the oncologist who was teaching it, and he said, I'm going to change the way you guys think about cancers. It's not a genetic mutation first. It's a mitochondrial dysfunction, and the mitochondria is not protecting the cell, and now cancer can happen. And I was just floored because that's, again, where we're kind of leading edge here, helping the mitochondria function. There aren't a lot of great things that we can use to help with mitochondrial biogenesis. We need our mitochondria to function. If they can't function, we need them to die or undergo. I see there's, medical people on here, apoptosis, right? Cell death. That's a good thing when it can't function normally. So our Protandim NRF1 is specifically blended, again, to help our mitochondria. And so that makes ATP, that makes energy, that helps our gene expression, protect our gene, protect our cells. And so we've got two pathways here that are helping the cell at the smallest level possible.
So there are more and more companies that are claiming to have NRF2 and NRF1 activators out there. How do you respond when asked about these other products, and what differentiates our Protandim NRF2 and Protandim NRF1 from these other products or other companies?
I love when people ask me this question, because I ask them, how many studies on PubMed does your product have? Because for me, it's validation, having those studies from multiple universities and not just a white paper. That's number one. Number two is that, like we talked about, the multiple patents are incredible for me to see. There's one specific study that is showing, taking any other blend, how their activation of NRF2 versus taking it as Protandim being 18-fold of an increase in that gene expression. That was important for me to see. I show that to a lot of people as well, showing the synergy. The synergy is definitely different. 2 + 2 is not 4 in this case. And I talk about ours being all natural. There are going to be other natural ones that come out. It's just kind of the name of the game with other companies wanting to do this. But again, I love that we are 10 years plus ahead of the curve with all of our science. And we're going to be ahead of the curve with the NRF2, and then we're going to be ahead of the curve with the NRF1 as we're first to market there. As far as pharmaceutical companies, there are two on the market. They are synthetic, and unfortunately, that's when we see a lot of side effects, because the cell's not in control. It's not always a pulsatile release. NRF2 specifically needs to be in a pulsatile fashion to make sure that the cell is protected. And so there are multiple pharmaceutical companies that are still in phase 1, phase 2, phase 3 trials trying to make a specific drug for a specific disease. It's not going to be for your well-being. Let's say, like right now, the first two, you have to have MS or you have to have ALS. Otherwise, you're not going to take either one of these drugs. And that's what's coming on the market as far as synthetics go and pharmaceuticals go. Other companies are trying to have natural ones. But again, I always say, show me the studies and then I'll take a look at it. Until you have studies, then you really don't want to look at it.
Amen. What other supplements would you recommend as far as a foundational nutrigenomic regimen? What else is important, would you say? The most important things you could do?
I think probiotics are incredibly important. Our microbiome is just needs to be taken care of. We are forgetting about our microbiome, and I think a lot of people would have better health if we focused on our gut health and got rid of leaky gut. The other part is omegas. It's kind of coming back into being popular again, but I remember 12 years ago telling people that they needed to get a good fish oil. I didn't know which brand back then, but I knew the importance of omegas as far as our nerve sheaths and the communication of nerves throughout the body, as well as other actions. And so nowadays there are multiple fish oils, and it doesn't matter which one you're taking, and you do have to balance with omega-3s because our diets are so full of omega-6s, unfortunately.
What other kinds of products? I know not everyone on this call is familiar with LifeVantage or the products that we have been talking about, but what other kinds of products does LifeVantage offer?
So the nice part is they've taken that NRF2 activation and they've put it in certain other products, so to make them first to market with being an NRF2 activator. So we do have a skincare line that is nice and clean and activates our NRF2 pathway on our skin cells specifically. We just released an NRF2 activated hair care system, so a shampoo, conditioner, and serum, which is just incredible to know that we have something clean again to use, to take care of our outside. We have NRF2 activation for our brain that is actually has some other ingredients in there in a drink that's like activated B vitamins, quercetin, DMA, L-theanine. All of these are brain food is what I tell people. This is what our brain likes. When it crosses the blood-brain barrier, our mood is better, our concentration is better. I can go on and on. So those are our NRF2 products. I personally don't take the one that we made for our four-legged friends. I've had vets taste it because they wanted to know what it tasted like. I'll tell you I'm not doing that. But we do have NRF2 activation for our four-legged friends. And then some of the other products that you had just mentioned is our NRF1 Pro Tandem. And then we do carry out an awesome probiotic and Omega Plus that has the vitamin D with the omegas.
Awesome. So just to close off here, as someone who's very passionate about nutrigenomics, and we can all tell that by how you've shared with us tonight, you must have a lot going on. And so what is it, what is it that drew you to this company, or why have you chosen to be partnered up with LifeVantage? And why do you think it is that other physicians may have also joined this company?
I think, well, I'll speak to myself first. My husband and I 4 years ago were looking at purchasing a franchise because we knew that he was going to be retiring in 4 years. And we wanted to know that process well. And we are just blessed that this opportunity came, because for the price of what we were putting down for a franchise versus starting in LifeVantage is hundreds of thousands of dollars different. And I learned another modality of earning money, leveraged income, that was completely foreign to me, completely foreign, where I had to have two separate people that have become my mentors explain it to me, plus my financial advisor, because all I knew was seeing a patient and fighting with an insurance company or getting paid cash, right? Like, I didn't know what leveraged income looked like. This is something where we are able to do the work once and build a team and have it continue to grow for us without as much effort. My best example is getting a penny for every bottle of Coke sold around the world, right? You introduce it to one person and they spread it out. It's kind of building a network. And what I love about this is it's given me a platform to teach and train not only people in our company, but staff. And during lectures, since I started, I've always lectured. I love lecturing because I love teaching. and empowering people to take care of their health. And this company has allowed me that platform. I'm super excited to be on their medical advisory board and be interviewed, like, by my colleagues like you in this company, and so that we can go and make a difference. And so it's become one of the mainstays for me, where I fit it into all my nooks and crannies of the day. And I'm going to be honest, I've gotten to retire my husband this year without having to put down $300,000 for a franchise. It was putting down $1,000, completely different set of rules here. And so it's blessed our lives. As far as other physicians, I think what's drawing them to this company is, one, the product. That's what drew me first, is the product and the science. And then realizing that there is another way where we can build a future, a plan B, and not worry about where medicine and the direction of medicine is going. A lot of us still have, I'm 15 plus years out from medical school, and I still have loans. It's crazy, and so I'm very excited to share this with people who are looking for a side hustle. I like that word, a side hustle, a side gig. And it might become full time for them, who knows? But it's a beautiful thing to know that you have another source of income, and it comes from helping other people's health, right? That's what's important to me.
Awesome. Well, thank you so much, Dr. Rodarte, for getting on and teaching us tonight. We really appreciate it, and have a great night.
Thank you for inviting